Greetings everyone. My name is Samvardhan. I was one of the 32 shortlisted changemakers for the 6th edition of FAIR Project 2025. As you all know that for this year we had the theme of public healthcare, and it has been an absolutely wonderful ride for all the changemakers, and we all got to learn so many different facets of public healthcare. So I wanted to make a short video to share my views and opinions from a legal point of view and from a public policy point of view, to give you a little bit of glimpse of what all we did in this year's FAIR project. In our initial phase, we got to interact with different distinct speakers in the FAIR project. And after that, we had multiple group discussions, deliberations, and research proposal. And what made this year's project extremely unique, that all of us got an opportunity to actually go outside and have our offline immersion by visiting different public healthcare centers, different hospitals in our different states. And I believe that is what made the FAIR project so much different and so much unique, because it was 32 change makers from Pan India, all different coming from different states, northern states, southern states, and all of us got an opportunity to actually go outside and visit these different PHCs and hospitals. And that made us realize that there exists so much of regional variations in our own states, but there is also a lot of harmony at the same time. And through these analysis, further we were divided into different groups. Some groups were discussing and publishing different illustrations. Some groups were further helping these ASHA workers, on-ground workers, frontline doctors in these PHCs. As a law student, I was in a group which was working on a white paper policy, which is supposed to be submitted to different stakeholders furthermore. And through these different groups, we were further looking at different solutions which we can propose to these public healthcare centers. And through that, we ended our FAIR project for this year. As the makers of the FAIR project themselves say, that the project never ends. It is our job to make this unfair world more fairer. So these are my views and opinions on this year's FAIR project and what all I had learned through this journey. Now, as a law student myself, I was able to analyze that there exists a lot of lagging factors in India, especially when we talk about the medical healthcare industry. So through this video, I wanted to provide my 3 key recommendations. First one, about devising realistic budgets for these different state governments to provide a good amount of funding to these PHCs. Secondly, about revitalization of our age-old British colonial laws, especially our medical legal laws. And thirdly, about the scope and potential of international arbitration in the Indian medical healthcare industry. Firstly, talking about the budgets, why do I stumbled upon the aspect of budgets is because when we were visiting all of these different PHCs in our states, for example, I visited 2 PHCs in Delhi and 2 PHCs in Noida. I was able to see that there exists so much of regional variation between these 2 states, between these 2 metro cities, and all of these different PHCs had different needs and requirements, but they all came down to one issue, that was the funding was scarce. There was scarcity of financial resources. To give a small example here, when I visited my Delhi PHCs, I was able to see that there was separate rabies unit made there. But when I came to Noida, there was a different picture. Many of these PHCs did not have a rabies unit at all, which made me question that why did they not deem these rabies unit as something which is important, because there are cases in these small tier 2 cities and villages. To which these frontline workers replied that oftentimes the stakeholders and the government does not deem these rabies unit necessary for the PHCs to sustain. Now that is a decision made by these policy makers at the state level. Similarly, all of the fellow change makers were able to observe that some of the other things were missing in these PHCs. Many of these PHCs did not even have the basic essential requirements, which made us question that on what grounds do the policy makers, or on what grounds are these resources or devices being provided to these PHCs. Now, as students, we do understand that from the perspective of government, these resources are very much limited. When we talk about on national level, on pan-India level, these financial resources are very much limited. And in that limited constraint, the government needs to cater to all of the people. So in order to provide a middle ground, a middle part to both the people who are in PHCs and to our frontline workers, and on the hand of our government officers, what we can facilitate here is, or what we can devise here is, external audits. External third-party audits can help these policy enthusiasts in devising realistic budgets for these PHCs, as different state government have their own different allocated budgets under which they operate, and similarly under which these PHCs operate. By hosting these third-party audits, the state government would themselves be provided with a realistic picture. And it is not entirely a new concept. I would like to draw a parallel connotation here. For example, organizations like NTPC Limited often invite quarterly based tenders applications from different contractors for their infrastructural projects as and when required. So the government has previously done this before, and I think it is not entirely a new concept and can be peacefully facilitated in this domain also. What these third-party audits can essentially do is can provide particular analysis which can be subjected to verification on a quarterly basis, and it also mitigates the possibility of having a personal bias in these budgets. So I believe that can be a very positive step in order for these PHCs to be allocated a relevant budget, according to which they can further have separate units for different lesser known diseases, or can invite more doctors on ground, more workers on ground. So that is one thing which we all came down to. Secondly, about revitalization of laws, I particularly believe that after the recent revitalization of a criminal and civil laws by Bharatiya Nyaya Sanhita, Bharatiya Nyaya Suraksha Sanhita, Nagrik Suraksha Sanhita, I believe the Indian judicial system has done much more towards revitalization of laws. But I do feel that there exists a larger part of it which needs more amendments. When I talk about the medical healthcare industry, it is one of the industry which is lagging behind. There are certain statutory parent acts like the Drugs and Cosmetics Act 1940, the Pharmacy Act, the Medical Devices Act. All of these acts were implemented by the erstwhile colonial government, or were taken inspiration from the erstwhile colonial government. And although the new notification rules were issued in the year 2019, but the evolutions or the changes which the public wanted to see, or which the doctors or the people from the medical health industry were expecting, were not reflected in the 2019 notification and rules. Now, the Parent Act, which is the Drugs and Cosmetics Act 1940, seems a bit outdated when we compare it to the present times we are living in, the present challenges which we are facing. Why do I say so? Because we are living in an era in which we are seeing that there are biotechnological medicines, there are different genetic medicines available, new forms of drugs are available in the market. And the most contemporary aspect of the medical healthcare industries are that these medicines and different drugs are being sold online by quick commerce platforms. When we are living in such dynamic era, such shifting times, regulation and compliance becomes a very essential aspect for us to pivot down to aspects like, are these drugs safe? Are these medicines safe? Or till what extent which organization can be held liable to? Is it the hospital? Is it the third party vendor? Is it the doctor who did the diagnosis? Or is it the patient who has taken these medicines from these big tie-ups or from these quick commerce platforms? These are certain questions which are a bit left unanswered to a certain extent. And when we go through acts like the Drugs and Cosmetics Act 1940, it appears to be outdated in terms of these questions. So I believe there is a need for policy enthusiasts and different policymakers to reassess these laws and understand what all needs to be required in the present generation. In this regard, I believe independent think tanks like the Observer Research Foundation or the Center for Legal Policy can be further invited to deliberate on these aspects and devise better policies for India. Why I feel that this is a very quintessential aspect in the present generation is because when we are dealing in the quick commerce space, there has been a recent increase in cases coming up wherein people are demanding that they have been wronged or they have been provided by the wrong diagnosis. And when they approach the legal authorities or when they would like to go through dispute resolution mechanisms, they often feel confused and feel puzzled that as per which laws and recommendations do I file my case, or under which rules and regulations do I testify that this medicine is healthy, this medicine is okay. So I believe these parent and statutory acts should be revitalized more. My third recommendation, which is interconnected with the revitalization of laws, is about that the FAIR project helped me in understanding that India holds so much scope and potential for international arbitration, specifically when we talk about the medical healthcare industry. To those viewers who don't come from a legal background, what is arbitration? So we know that conventionally, for resolving legal disputes, people go to courtrooms. However, through ADR mechanisms, it is a much more cheap alternative, a much more time effective alternative for people to go through that channel. Oftentimes, when people go to courtrooms for their dispute resolution, it takes years and years of effort, years and years of hard work in approaching to the court, and it also requires a lot of heavy amount of capital. ADR mechanisms, alternative dispute resolution, involves mediation, negotiation, arbitration, conciliation. These channels provide you to resolve your disputes in a much more time efficient manner. And the past decade has seen a recent rise in terms of ADR mechanism. And along the same lines, I wish to talk about arbitration in the medical healthcare industry. Why do I stress upon arbitration? Because the FAIR project made me realize by our on-ground research and the research we did for our white paper policy that there has been a recent increase in cases between our frontline doctors in private hospitals or government chains, or different pharmacists and the medicines they are being provided by the company or by the consumer at home and in between these quick commerce platforms. These complex web of disputes would often take courtrooms to further take years and years to deliberate and give proper judgments, some of which are have very new facets. And medical healthcare industry having legal disputes is not a new phenomena. When we talk about law, very important aspects like medical negligence, the tortious law, there have been a lot of cases, and if we go back to our landmark judgments, the courts have taken years and years of deliberation to give out a final judgment. So why not go with arbitration? In arbitration, these parties can conventionally decide and appoint an independent arbitrator together and further resolve their disputes there. Now, why am I stressing upon arbitration here? Because in a lot of cases while studying in the FAIR project, I was able to see that key contractual terms were often deliberated between doctors, frontline workers, and the organizations they were working under. And on the other hand, there were a lot of disputes between the consumer who has been given wrong medicines, or the consumer who hasn't been provided with a proper diagnosis and who has approached or bought these medicines through third-party vendors, quick commerce platforms. So who is supposed to be held liable in these cases? The consumer at hand, or the quick commerce platform which is providing them these medicines, or the manufacturer? So these complex web of disputes can be resolved through arbitration. The American hospital chains and giants have already seen what arbitration can bring to the table. And similarly, I would like to suggest the same here, that our incoming new private chain hospitals, new pharmacy giants can approach a similar manner to peacefully resolve these disputes and in a much shorter span of time. Since we are living in an era of dynamic supply chain of medicines, drugs, or different contractual terms have come in play, there exists a need of a more updated framework, and it is very much understandable that drafting and issuing of a new law would take years and years of time. However, it is the job of the legislature and the policymakers of the present generation to deliberate that if there exists a possibility of having an interim ordinance or an interim regulation, specifically when we talk about the compliance of these new age medicines, can that be issued presently in the current generation? If there is a possibility of the same, then that should be approached, because there exists a very huge requirement for the same. And thirdly, about the scope and potential of international arbitration in the present generation, which can provide a more peaceful route to these different forums of dispute. And also, it is a much more cheap and cost effective manner, because whenever we have seen disputes between consumers versus medical hospitals, or consumers versus pharmacy companies, the consumer at large is required to pay a lot of amount even while approaching to the courts. One of the very important points when we talk about arbitration is that in India, many of these medicines are being manufactured and are exported by different countries. So it is not always the fault of third-party vendors or our quick commerce channels. It is also very important to understand and analyze which companies or which country is exporting these, medicines and products. So I believe international arbitration gives a very good peaceful route of resolving these disputes at a much cheaper rate, specifically for consumers. So that was it from my end, and I hope you all enjoyed this video. And at the end of my video, I would just like to say that every citizen, be it someone who is rich or someone who is poor, has the right to live their life healthy, happily, and safely. And it is our job as policymakers, as the youth of India, to make a generation which is better for our upcoming kids who will grow up in this country. So that is all what I wanted to say. And again, I would like to thank to the entire team. I would like to give my regards to the entire team of Fair Project for giving me this opportunity to study these issues to this depth. And I'll be forever grateful for that. Thank you so much.